Yes.
And you designed this research.
Yes.
Okay, so why did you design the research? Why was it important? And what did it show?
All right, so thanks for the opportunity. And we designed the research together with UNICEF, the Homa Bay County, and our partners from UK called ODI.
Okay.
And the idea was to find out why do we have HIV and unintended pregnancies persisting and being at such a high rate in Homa Bay County.
Yes.
And the county was very eager to see and to come to the root cause of the problem. And the numbers have already been found that the numbers are high. So the question is the why. So our study was more digging into the reasons why this happens, talking to the girls, their parents,
Yes.
the boys, and the community at large to find out what exactly was the problem.
Because in the region, Kenya is seen as a country that's done well when it comes to HIV. Our numbers are coming down, prevalence has come down, people who are HIV positive are on medication. So we seem to be doing well. But in this particular area, we're not. So what are the three big whys? And I'd like, we had seen your press release. I'd like the viewer at home to see some of your results. So if we can have that on the screen.
Yeah, and when we're talking about adolescents, this is the age between 15 and 19?
19 years.
Yes, okay. So what are the three things, like Valentine asked, that you would say are the leading causes of unintended pregnancy, and then of course by extension the spread of HIV and AIDS?
Okay. So the study and most of our work and actually the statistics in Kenya show that the problem is, it's in both the adolescent boys and girls, but it's worse among the girls, actually like double the rate. So the key factors are, a lot of it is lack of information. So just lack of information on how to prevent HIV, how to prevent pregnancies generally at that age. Then there's lack of access to services. So even if they wanted and they knew what they needed, there's lack of access. And then we have cultural factors, or social, like gender norms, gender practices.
Sorry, can I just ask you to pause just for a second, because you sent us the information. I want the audience at home to be able to read what these risk factors are, particularly in Homa Bay, because they are what you're talking about. There's a cultural issue. There's also this lack of information. So yes, we can see this, the risk factors. Adolescent girls have little negotiating power when it comes to condom use. What do you mean by that?
So back to what I was saying about gender norms.
Yes.
It's all about power and who has a power in relationships. So in our African setup, women generally it's a patriarchal society, so the men are more powerful than women. So when it comes to trying to say that we're in a relationship and therefore I need to protect myself from getting pregnant or from HIV, and I would like to use a condom, for example, the girls are not given that chance, or they're afraid of saying it just because of how they know the power dynamic is.
Okay.
They could either face violence or even rejection and be abandoned. So that's a big fear that they have.
Okay. One of the main risk factors I noticed is that you talked about disco matanga. Okay, what is disco matanga? We've heard the songs, we've danced, but what is it? Like really, what does it look like in Homa Bay?
So for those who come from Homa Bay or western part of Kenya, it's that overnight vigil when the body stays, it's awake at night. So the body stays overnight in the home, and then there's a big party and a celebration where everybody stays out all night, and there's festivities and celebration. Okay. So what happens is there's fun, there's darkness, there's free spirit to do anything that really people want. So there's a lot.
So if you're a child and your mother typically is like, be home by 9, disco matanga, you can come home tomorrow morning. So of course it's a problem with teenagers. Okay.
I have a question, because I know Kenya has got the adolescent sexual reproductive health policy, and I know the previous one, the term of the previous one expired, and then there was another one that came into place. Why is it so difficult to step down? And because the adolescent reproductive health policy talks about all these things and all these risk factors that the report has highlighted. Talks about things about access to comprehensive sexual reproductive health services. It talks about the harmful social cultural norms and all those things. Why is it then so difficult to be able to step that down to county levels?
I think there was a lot of goodwill in the creation of that policy.
And there's a lot of work and stakeholder work went into really digging down what are the issues, you know, around adolescent sexual reproductive health. They picked out very valid, you know, vulnerable groups that had to be, you know, provided with this access. The frameworks were the same. But as with policies, you have to be able to ensure that the policies are implemented and cascaded downwards. That hasn't been cascaded down into healthcare systems. The adolescent responsive systems, adolescent-friendly services are not there. We still have a lot of judgmental practices.
I don't think a 15-year-old girl, this is the same framework that allows for teenagers to walk into health facilities and ask for contraception, right?
Absolutely.
But they're shunned and they're laughed at and they're sometimes even kicked out.
Absolutely. So that policy and another one that talks about, you know, research among adolescents and even the one about HIV guidelines in terms of testing allows a 15-year-old to go and get that service without parental consent. It allows you, if you are, you know, sexually active, to be able to go in and actually get, you know, contraception. But what do you find at the end of that road? Do you find a judgmental healthcare provider? You know, is there a stigma in the society when you're seen walking into that
Do these teenagers even
facility?
know that they can walk in and ask for help? Or is it like a rumor, like it's almost a drug deal, literally, like it's not your right?
And that's the crux, because with policy has to come a lot of health promotion, has to come a lot of including this in terms of educating, creating demand for the service. How do you create demand for the service? You ensure that there's education. The adolescents are educated. That
My question to you would be, are we burying our head in the sand as a nation and say, you know, this thing is not happening, and you put your head down and you say, if I can't see it, then it's not happening? You know, is it time for us to wake up from that? Because I think for the longest time we've been burying our heads in the sand and saying, no, you know, this thing is not really happening. And
I grew up.
Yeah, and
I'm okay.
And the more we talk
no
about
one talk
it,
to me.
Yeah, and the more we talk about it, we are now not creating awareness, but encouraging adolescents now to go and encouraging risky behavior in adolescents.
Absolutely. I think from Dr. Tiso's and team study, a lot of the findings talked about abstinence still being preached, you know, in this day and age, or the family health education coming on a little bit too later. So the girls had already either dropped out of school or are not there anymore. And so a lot of the education is from the NGOs, the internet, their colleagues. And so access to these services is just, is available, but they're not aware of it. And when they're aware of it, there's a lot of stigma towards how they gather.
There's something I want to ask. You said in the girls, the HIV rate is double what it is in the boys.
Yeah.
Why is that? Is it that they're not having sexual relations with their peers and they're having that sex with older men, in which case it's statutory rape, or what's actually going on? Why is the number double? Because that to me is stunning, really.
Yes, so what we've seen is that first, the sexual debut or the age that they start having sex is younger among the girls than the boys. So that already they're exposed for longer, so the chances of them getting infected are higher. And yes, they do have sexual contact with people who are older than them, who are post-adolescent age. But at the same time, they have
You're
sex
being
with their
so
peers.
nice at the post-adolescent. Isn't that an adult?
It's an adult, but as I said, they will have relations with both their age mates and older men. So it's a very complicated kind of setup. And a lot of it is transactional sex, especially in places where there's a lot of poverty. So by that I mean that you're very poor, you don't even have food, you don't have money for pads. So you find a man who is working, and it's something as basic as the boda rider, the local teacher, or the matatu tout.
Somebody owns a kiosk and can give you the
and he
pads.
can give you a little bit of money, so that informs the relationship.
In the coast, specifically in around areas like Mombasa, Kilifi, one of the things that you know, we have seen there is when you talk about transactional sex, you're talking about sexual exploitation. We've seen cases where, because of poverty, mothers or parents send their young girls to go and work in the homes of either civil servants or somebody who they know has got a steady salary and a steady income. And by doing that, trying to encourage a relationship between the adolescent girl and that person to sort of try and secure an income for the family that
this way. Is that what you're... Okay.
Are we seeing the same thing happening in Homa Bay?
Well, we didn't see that per se. What we saw is more of, as I mentioned, a young girl is there and she's wondering, why is my friend who was poor like me suddenly dressing better than me or having more fun? And then she tells me, come we go here. So it's more driven by the girls themselves than their parents. In fact, the big challenge we saw in Homa Bay and related to the issue about burying heads in the sand is that nobody knows how to talk to the girls or even boys and what to tell them.
Yeah.
The parents said, we don't know what to tell these children. Even if a girl has already got a child at home, they still don't know how to talk about sex and how to prevent pregnancy or
even
HIV. Even if it's clear, yes. And then the fathers say it's a mother's responsibility. And the mother says, I don't know what to do. I'm
so
helpless.
there is a mother, there is a parent watching that right now with an adolescent in the house saying, Guy, where am I going to get this information from? How do I start talking to my child about this issue? Because we always imagine there's this thing called life skills that is taught in schools. And we all imagine that that topic will sort of be covered by the teachers there, and it really isn't. So for a parent who's watching right now, with an adolescent in the house saying, I need to know where to get this information, I need to know how to talk to my child, or refer them to somebody who can talk to them on my behalf and give them the proper information, where would they go to for that?
Okay, so there are different programs. A lot of them are NGO run. Okay, before I go to the NGO, even the health facilities. Actually, from our study, a lot of people say they get information from health workers.
Oh, that's good.
Yes, so they can get, if they wanted, sometimes health workers even come to schools and communities and teach them. And many of those are programs which have been run either through government or even NGOs supporting that.
Okay.
And then now you have different programs. For example, at LVCT where I work, we do have a toll-free hotline. So you can call, the number is 1190 or 1190 and get information. The young person can call, the parent can call, and it has website, WhatsApp, social media platforms.
Again, the number is
1190.
So
yes.
pick up the phone even right now.
Well, up to 10 p.m.
Up to 10 p.m.
Yes.
Okay.
So that you can provide that.
I really want to know, this is my belief, having been a sex writer for over a decade, people don't struggle with the biology. We all know the names of the body parts and what goes where. That is actually quite easy to explain to anybody. What we all struggle with, even into adulthood, is that negotiation. When do I bring up the condom conversation? When do we say, are we going to use the pill? When do you say, I want to kiss you, but I don't want to sleep with you? And you like this person, and you want them to like you. That's what we struggle with, isn't it? Yeah. So where is that information for our kids?
So I think we want to be honest and say that this thing was generational. I don't know, Valentine, if you had that conversation with your parents.
I had a very open mother. Even as soon as I had my son,
yes.
when I got my period, maybe that's too much information for TV, she said, remember, you can get pregnant now. I'm like, Mom, I think I know. But yes. I have that mother, yes.
But usually the conversation ends there. There's the warning, you can get pregnant. But there's no conversation about, in the event that you are sexually active, these are the things that you need to consider. And I just for a minute want to just, bring the conversation, to skew it a little bit. We're having conversations about, teenage pregnancies, but then we're not having adolescent girls, but then adolescent boys are in the picture. Remember, we've talked about the conversation around it's both intergenerational as well as transgenerational. And we need to get to the place where everybody, this activity that we are carrying out has consequences. And so, like you said, when the adolescent is guided towards conversations around reproductive health, it should be the adolescent girl and the adolescent boy gathering these life skills together, And so that's why I'm saying there needs to be a paradigm shift. I like the forward of the reports that Dr. Otiso and team put through when the county executive, I think it was county executive officer, says there needs to be a paradigm shift in our society about the way we think about reproductive health, about the way parents discuss this conversation. It can't be status quo because times have changed. Our children know a lot more and are exposed to a lot more. So I think at the end of the day, like you said, the biology is talked about, but the consequences, the actual conversations around, let's talk about, if you are approached for sex, what do you do? How do you respond? How do we go about this? When do you use a condom?
We also find situations where adolescents become, because of the relations that they have, either between adolescents, but specifically between adolescents actually, you find children becoming in conflict with the law. And so then you find situations where a boy who's 17 and a girl who's 15 got into a sexual relationship, and then the boy is arrested for defilement, and that becomes now a very complicated issue about then who defiled who.
They're both minors.
Yeah, both minors.
See, I also, back to what you're saying about the paradigm shift, I think that also requires a paradigm shift. These are two idiots, for lack of a better word. Is the blind leading the blind? Who defiled who? I think that is placing too much responsibility. Why is it that the boy was not, is being placed in a superior position of authority as opposed to the girl? They're both the same. They're both children. They should be treated, in my opinion, exactly the same.
Yeah, but what you find in the reality is then you find that, you know, a lot of boys then are the ones who are, you know, getting in conflict with the law in that sense. And so you find a lot of communities are actually even having the conversation about why are the boys the ones who are being jailed?
That's true.
You know, that sort of thing. So I mean, it's a very complicated situation to be in. And I think there is no one-size-fits-all answer. But as we continue the conversation, remember, you can join in as well. And the question that we're asking you here is, should sex education be taught in school? Is it time for us to teach sex education in schools? And we can also call it comprehensive sexuality education. So let us know what you think about that. You can talk to us using the WhatsApp number, which is on the screen right now. Remember, you can also use the hashtag, the loop K24. More when we come back. Don't go too far.